So I want you to take a good look at this beautiful picture. This is a picture of a pregnant woman. I'm pretty sure you love it, right? Yeah. So once you're pregnant, obviously for you to remain beautiful as the lady who just showed, you need to do some checks, and this has to be done in a hospital. That is why you will probably be visiting the hospital. When you're pregnant, you'll be visiting the hospital. Depending on your physical state, but it is normal that you will be visiting the hospital from time to time. Why? To do a check to know about how your baby is and how you two are doing. Now, getting pregnant is a beautiful thing, obviously. But once you get pregnant, know that visiting the hospital will become like a new norm to you, which is normal. Please don't feel bad if you have to visit the hospital from time to time. Your very first ever clinic, when you visit the hospital for a checkup because of your pregnancy, you're going to run a series of tests. So we'll be going through these tests and interpreting them for you. What these tests will mean if they are positive, what it will mean if they are negative, what will mean if the test shows normal or abnormal. So we'll be explaining this together. So to give you a clue about this, so we're talking about your own genes, your own cells of the body, like the blood grouping, like the HB genotype. We are talking about parameters in your body, like knowing your blood level, that's knowing your HB level, like also knowing if you have something like glucose in your urine or protein in your urine. Also, you need to know the various STDs like HIV, hepatitis, syphilis, chlamydia, gonorrhea, trichomoniasis. It is also important that you know that you will also be doing something like Toxoplasmosis, Rubella. Toxoplasmosis is very important. You will understand this as we explain ahead. So stay with us. Let us explain this gradually. So when you're pregnant, there are a lot of issues that need to be addressed to make sure that you're fine, to make sure the baby is okay, to make sure that even after pregnancy, the baby doesn't have complications and you too don't have complications. So you'll be visiting the hospital from time to time, but there is the very first ever clinic you will visit, right? The very first ever time you go to the hospital because of your pregnancy to do a check, and that is called your first ever prenatal clinic or antenatal clinic. In this first ever clinic or first ever hospital visit when you're pregnant, you're going to do a lot of things, and one of it will be to know your blood group. Okay, you need to know your blood group. If you've not known your blood group, you will need to know it, because it is so important to know your blood group. The next will be for you to know your hemoglobin. Hemoglobin is the HB, the level of your blood. You know, you are carrying two people already, in the sense that you're carrying yourself and also carrying a child. And by doing this, you are protecting the child and also protecting yourself. Because let's just take for example that there is an issue maybe with your blood level. Obviously, you can die because of anemia, that's extreme low level of blood. So it is very important. The next thing is you're going to know your HB genotype. The HB genotype, which is the HB electrophoresis test, which we've mentioned here a lot of times. Now this one, it will be done if you don't know it. Not every hospital will request that you do HB electrophoresis again, but some will actually request for it, and if they do, then it is know that it is important for you to do. You have STDs to carry out. One of the very first STDs is syphilis, HIV. So you have HIV as an STD that you need to carry out to know if you are infected or not. You also have syphilis, which is an STD which you need to carry out to know if you are infected or not. If you are infected with HIV, obviously, you go on your treatment. If you are infected with syphilis, you also go on your treatment. There is gonorrhea. You also check for gonorrhea to know if you are infected or not. There are other infections like trichomoniasis, there is chlamydia. All of these fall under STDs. We need to take note, STDs is dangerous, especially something like syphilis, chlamydia, gonorrhea, because they can actually cause you to have problem with that pregnancy. You might have miscarriages because of that. So doing all of this is to protect this pregnancy, to make sure that the pregnancy continuously go ahead as normal with no problem. You need to understand that for you to have an STD, at times you may not have symptoms like this, because most people be saying that, but no, I don't have any symptom. If you're pregnant, make sure you follow the instructions such that you can be fine and the baby to be fine as well. If you're waiting saying that, no, I need to see signs and symptoms for some STDs before I go visit the hospital for it, no, you are doing the wrong thing. Look at these pictures. We need your pregnancy to be smooth, just like the pictures you're looking at. And for it to be like that, you need to run all of these tests so that you can have this smooth, right pregnancy. The next thing that we will look at will be toxoplasmosis. Toxoplasma gondii is actually a parasite that can cause you to have issues with your pregnancy. It can really cause you to have afterbirth effect, like what you are looking here. So this is hydrocephalus. Hydrocephalus is actually afterbirth effect, and one of the things that can cause this is actually toxoplasmosis. We know in our area people don't want to run something like toxoplasmosis because it is expensive. Please, if your doctor requests you to do toxoplasmosis, please try and do it, because despite that, it can also cause you to have miscarriages. Another thing you will need to look at is actually rubella. Rubella virus is a virus that can cause you to have stillbirth. It can cause you to lose your child. So it is very important that you also do this test and you know exactly if you're positive or negative. Now, rubella virus also is expensive within our area. But if you are requested, if your doctor asks you to do it, please do it. You can request it yourself. You can tell your doctor, oh, I really want to do this test. I heard it's important, so let me do it. Because in our area, things are really tough. For you to have your healthy child, have your healthy baby, for you to be healthy, the best thing is that you do all of these tests. You see that your pregnancy will move smoothly, shining, with no problem at all. But if you start like holding yourself away, that no, come on, maybe I don't have money to run this, then it could be dangerous for you. It could be dangerous to the unborn child. It could be dangerous even after the pregnancy. Remember, the protection of you running all of this is to protect you, protect the child, and also to make sure that even after pregnancy, the child will be fine. Just like we mentioned that with toxoplasmosis, you may have afterbirth. Hence, the need for you to take this very serious. Whenever you visit, whenever you go to the hospital, make sure you take this very serious. If your doctor asks you to do something, make sure you respect it. We wish every lady the very best. We wish your pregnancy to be shining as the pictures you're watching. We wish your pregnancy to be the very best. We wish you not to have any complication in your pregnancy. Make sure you follow every instructions. Please keep safe, subscribe, share. Thank you.